All right, good morning. It's good to see you on this beautiful Wednesday. I trust that you're well. Thank you very much for joining us on My Doctor. My name is Winnie Lubamba, and as we always say, it's a pleasure to have you on board. Now, well, research suggests that sexual dysfunction is common, and that is 43% among women and 31% among men. Of course, report some degree of difficulty. It is a topic that many people are hesitant or embarrassed to talk about. Unfortunately, most cases of sexual dysfunction are treatable. And right here on My Doctor today, we want to talk about this very sensitive topic that most people are not okay to talk about. So we'll be focusing on sexual dysfunction among the females. And I'm pretty surprised with the numbers. That is 43%. That is like a higher number. But hey, we'll find out why the higher numbers among women, that is on sexual dysfunction. So if you have any question, then 0791 478990 is the number to call in live, and of course we'll answer your question as soon as we get it. But before we get into this very sensitive topic, let's take a look at this video on sexual dysfunction. All right, welcome back. Glad you're still with us. Just in case you're tuning in, today we'll be focusing on female sexual dysfunction. And from what you said, 43% of women, of course, report some degree of difficulty. And like we said, this is a topic that most people are not okay to talk about it. We try to hide it as much as possible. Probably some people suffer in silence, but that is what we'll be focusing on today on My Doctor. So if you have any question on the same, then feel free to call us live. Our lines are open. So call in live, 0791 478990 is the number to call in, and of course we'll answer your question as soon as we get it. So with me is Dr. Grace. Of course, she is here to help us understand more on sexual dysfunction. And like we said, the topic that not so many people are okay to talk about it. But before we get into all the very sensitive discussion, kindly introduce yourself.
My name is Grace Wanjiko. I am a resident in obstetrics and gynecology at the University of Nairobi.
Okay.
And my practice area is, as I said, reproductive health.
Yeah.
And yeah, I'm in my third year of training.
Okay.
Yes.
All right.
Pursuing a master's in this field.
Health.
Yes.
Okay. All right. Perfect person to talk about this issue. Now, let's start with the numbers.
Yes.
And I think during the short break, you're telling me that the numbers are slightly higher.
Yes.
Why is that? And especially the women, because I thought that the numbers would be more
For the
yes, for the men, simply because when you walk around town or listening to radio or whatever it is, you find that there's so many advertisements about, I don't know, like treatment options or all those methods to help men who, have like sexual dysfunction.
Yes.
So I'm surprised, like, wait, what about the higher numbers in women?
The challenge we have with women is, one, we don't have like a treatment or how do I put, like a pill, like people talk about the blue pill for the men.
Yeah.
Women don't have that.
Okay.
And as we discuss the topic, we will realize that one of the causes of female sexual dysfunction is issues to do with hormonal changes in women. It tends to affect women because women, their reproductive cycle is affected, is basically controlled by hormones. And these hormones change throughout the woman's reproductive cycle. Okay. And at some point, the certain hormones, the levels go very low. So at that age, what we usually call menopause, the changes in hormones, the low hormones, they tend to drastically affect sexual drive, sexual desire, and sexual pleasure.
Okay.
Yeah.
All right. So we'll get into all that. But now, sexual response.
Yes.
Let's just start from there. What exactly is it, and what does it involve?
It's usually a cycle that involves four main stages. Okay. So there's the excitement, then there's the arousal, then there's what we call the big O, or the orgasm, and then there's the resolution. Okay. This cycle affects both men and women. Both men and women go through it at the same time. But it is it's not usually common to have them go through it at the same time. Okay. Women and men respond differently to each one of these cycles. Okay. So those are the four main stages of the cycle. Okay. Yeah.
All right. You said we don't get to all of them most of the time at the same time.
Yeah.
So
yeah.
It's and then build up. To
yes.
Maybe
Yes.
The last,
That's why they are one of the tenets or one of the very important factors in dealing with these issues of sexual dysfunction is issues to do with communication between the partners, knowing one another, knowing how each one of the persons responds in each one of the stages.
Okay.
Yeah.
All right. Now, can we talk about the stages in detail and how, because I want to think these are the most important in terms of the topic that we're talking about today, that is on sexual dysfunction.
Yes.
And then also, what about the mind? I mean, does the mind also play a role amongst the key the four stages that we're talking about?
Now, actually, it is said that the brain is the largest sexual organ in a way.
Okay.
And this is because anything to do with sexual desire, sexual arousal, sexual activity starts in the mind. Since we are concentrating more on the women today, women take longer in terms of each one of these stages. But the different women have different responses. So it's not like one size, if I may call it, fits all. And so it is said like that you need to, because it is usually an activity, a consensual activity between two people, you need to, the male partner needs to understand the female partner.
Yeah.
Some people actually say that if you want to have any sort of sexual activity, maybe later in the evening, it starts in the morning for the woman.
Okay.
For the woman, it starts in the morning.
Yeah.
So you need to start giving clues, treating her nicely so that she starts picking cues. Then during the actual activity,
yes.
The women tend to take a bit longer to respond in each one of the stages. So the excitement probably will have started much earlier, and then you come to the stage of arousal.
Yeah.
So this one requires the involvement of the other partner, and it's like priming, if I may call it.
Yeah.
So you need to prime her, and it involves other activities. Then you get to the orgasm part, which is usually called like the climax. So that one involves contraction of muscles and release of some, we call them feel good hormones.
Yes.
That's why people say it feels good.
Yeah.
Yes. Okay. And then now after the contraction of the muscles, then after that now you have, it's like a rest phase, what we call the resolution. In between the the excitement and the arousal, some people talk about a plateau stage, somewhere around there. So different people will respond differently. Now for the men, these stages sometimes tend to go very fast. Yes. So that's why you need to understand your female partner and understand for both of you to be able to enjoy sexual pleasure, you need to be patient with one another and you need to understand one another.
Okay, you mentioned that both men and women respond differently.
Yes.
But I'm pretty sure you've had this discussion where some people are, in terms of time, before you get there.
Yes.
People are like, but there's one who takes like a very short time and the other one is like a very long time. So is there a standard time when you can say both parties get sexual pleasure? Because there's some people who are like, this one's like 2 minutes and probably she's out. The other one is like maybe an hour and she's,
an hour would be long.
Yeah.
I would say an hour is long.
It's too long, okay.
I'm not sure there's a specific time frame.
Okay.
And I don't want to give like a specific time.
Minutes.
Yeah, 30 minutes or 1 hour. I don't want to give a specific time frame because then that puts pressure on someone who either takes a shorter time or a longer time. But an hour would be long.
It would be too long.
Yes, an hour would be a bit too long.
Okay.
For either one of them. Yeah.
Okay.
So maybe on average, like 20, 30 minutes.
Yeah.
And since we said it's a cycle, it's something that can be repeated again. Yes.
Okay. All right. And now in terms of understanding if this person had pleasure or not, because I'm pretty sure there's some people who are like, well, after that we didn't, like probably went to sleep or something and then we don't know, did they probably enjoy the moment or they didn't. So this, I think, puts a lot of pressure on people
Yes,
as well, and especially, I would say them both
Yes,
parties, not
both
to say
parties,
more,
yes.
men and women. So how do we, I don't know, in terms of, let's say this person has gone through all the stages that we got, and is it possible for someone to maybe skip a stage and go from maybe the first stage?
One first stage to the next. I wouldn't say skipping the stages.
Okay.
Probably one stage would be shorter than the other one. For different people. So different people have different ranges of time they spend in each one of the stages. For the knowing whether someone has gotten to the climax or they have enjoyed the sexual activity, probably it would be good maybe if with your partner, maybe you ask them or talk to them.
It.
So open communication is very important. Very important. Honest, open communication is very important when it comes to enjoying sexual activity, so that if you're having any difficulty, then you're able to communicate the difficulty to your partner and they're able to adjust or they're able to help you overcome the difficulty.
Okay.
Yeah.
All right. Now, you also mentioned something to do with preparation, like prepare, especially for the women. Like I said, we take longer in terms of preparation. So probably the men watching us right now will be like, but wait, do I really have to start in the morning? Like, can't it just sometimes? It's not just happen.
Yeah, it can. Okay. It can happen.
All right.
What you call, there's a word that the street language calls it. I think they're called quickies or something.
Yes.
Yeah, those ones. It can happen. Yeah. But for the women, it has been known for a long time that their sexual response tends to take slightly longer than the men. Okay. But now this is for the majority of the women, not for every woman. Yes. There are women who are actually, it's like the reverse. Like they almost respond almost the same with the general men population.
Okay.
Yeah.
All right. Do you think it's because sometimes people tend to take it seriously, like
too seriously?
Yes.
Yeah, maybe.
Like
maybe.
Like
yes. Spontaneity has also been shown to, like, just being spontaneous. Of course, within the confines of decency.
Yes.
Spontaneity has been shown to be, something that brings about, how do I put it? Brings about excitement. And more pleasure. Yeah.
Okay.
So that aspect of spontaneity can actually help, especially in relationships or partnerships where the issue of sexual activities and sexual pleasure is dwindling or is suffering. Yeah.
Okay. All right. Now, so all those stages and of course what we've discussed in consideration. Yes. So where does the sexual dysfunction come about? Now, and especially for the female, now that we're focusing on the women today.
Yes, so sexual dysfunction,
and first of all, what is it? Let's start with what exactly it is.
That's the part I wanted to like try and define.
Yes.
I would say it is any deviation or any discomfort in terms of either lack of or discomfort, lack of in terms of sexual desire or sexual excitement, lack of either discomfort in terms of pain during sexual activity, or low sex drive, generally what people call low sex drive, that interferes with your sexual activity, sexual pleasure, and most of the time tends to interfere also with your relationship with your partner. Yeah.
All right. So how does it, and what are some of those, like, let's say, start with the different, maybe types? I would say,
there is what is called female orgasmic disorder. Okay. There is also what is called a female interest disorder, whereby the orgasmic disorder, you will realize, as we were talking about the cycles, there's a place where you have the orgasm stage. So these patients tend to, I'm calling them patients because these ladies tend to have a problem achieving an orgasm. Okay. The other disorders are mainly to do with the interest itself. Like they don't
Someone
have,
doesn't have an interest.
Yeah, they don't have an interest at all
Okay.
with any sexual activity. The other disorders are to do with the pain. Either pain or discomfort. It can start with either discomfort or just pain itself.
Okay.
Yeah.
All right.
So that has to do with the activity itself, during the activity itself.
Okay.
The issue of interest is sometimes usually outside the activity. Yeah.
Okay. All right. Let's start with the orgasmic disorder. How do you, okay, as a lady, how do you know that like you have this particular disorder? And I'm pretty sure this can be really frustrating, especially to the man. Be like, wait,
yeah,
what is going on here?
What's happening?
Yeah.
For the person suffering from the sexual disorder, I think they themselves, it would be difficult for them to actually know that I have this particular disorder. You would need to see a sexual health expert or a gynecologist, because diagnosing the female sexual disorder is usually a challenge in itself. And it involves a lot of talking, It's not like the other common illnesses where you can do a test, or you can do, an examination, or you can do an X-ray or an ultrasound and say, aha, that is the problem. So this one involves a lot of talking, a lot of, describing how do you feel, where do you think the problem is. But most people, they will know. They know I have a problem in this area, and especially because women talk a lot. So when you're talking with your girlfriends and they tell you what their experience was like, and you're like, I've never experienced that. Something like that.
And how is that possible?
And that because different people are different. The human body between one person and the other one is completely different. Yeah. And sometimes actually there are some people who will actually experience the orgasm, but they don't know that they actually experience
so
the
I
orgasm.
think they
and the experience
that
itself
disorder,
for one person is different from
the other
one. There are those who will get, let's say, like they call them multiple orgasms, and there are people who will just get, one and you're done. Yeah.
Okay. So and in terms of sometimes getting there, let's say there's some people probably who get there early, and others probably take time.
Yes.
Is that normal, or maybe?
No, it's the normal body.
The way the body responds.
The normal body response. But then again, issues to do with sexual activity, sexual pleasure, achieving what you would say is the optimum sexual pleasure requires practice. It's not something that you do one day and you've gotten it. It requires, especially in a committed relationship. It requires a lot of practice, a lot of experimenting, within the confines of safety, of course. So and it requires it takes time. Yeah, so it's not something that you just do and Yeah, so it might start with difficulty, and then with communication and intervention, you end up realizing that it wasn't as bad as I thought.
Okay, but I'm pretty sure they can be frustrating, especially for
for
the woman.
Yes,
and so how do, because we said sometimes there's some people who might have that particular disorder and don't know they have it. So what are some of the ways that, let's say, we can tell, because probably someone is watching us right now and thinking, wait,
probably,
maybe, so how do I know? So are there like some symptoms? I know
symptoms,
they might not like
signs.
physical, but
for the sexual interest disorder, or the orgasm disorder. Let me start with the interest disorder. You have no interest at all, like you are not interested in any sexual activity. You don't have any sexual fantasies, because as we said, the biggest activity, if I may call it, happens in the brain. So you need to start with imagining or fantasies or thinking, I would like to experience this, I would like to experience that. If that never really happens in your mind, then there could be a problem. If you don't have any sort of attraction towards a person either of the opposite sex, that is if you're heterosexual, or depending on your sexual orientation. If you don't have any sort of sexual attraction towards another person, then you could be having some element of female sexual dysfunction.
Okay.
When it comes to the sexual activity itself, if every time you try to engage in the sexual activity with your partner, either you feel pain, or you know, it's very uncomfortable,
Okay.
or you know, you have gone through the whole activity and there is no pleasure at all, you know, then there is probably a problem.
A problem.
Yeah.
All right. And still on the interest part, do we say this might arise probably from, I don't know, like different, let's say, circumstances or experiences that one has encountered, or where exactly does it come from? Yeah.
So there are different causes of female sexual dysfunction. They could be hormonal, they could be things to do with social experiences, it could be related to a medical condition, especially any medical condition that interferes with your hormonal environment in the body. It could be related to surgery, it could be related to childbirth. So, and also your upbringing and your beliefs, because like in the African culture, most African cultures, the girls are brought up knowing that, you know, that's a bad thing to do. Don't even think about it, you know, don't even engage with anybody of the opposite
don't even
sex.
say hi to a boy.
Don't even say, you know. And so you grow up with that kind of mentality, and then when you get into a committed relationship or marriage, then it becomes difficult, because at the back of your mind you are told this is a bad thing, and so because it's a bad thing, you know, your body kind of shuts down about it. But that can be helped with the seeing, you know, a medical specialist or a doctor, or even counseling. Counseling can help. Now the other experiences, social experiences like sexual assault, rape, because it's a traumatic activity, it's a traumatic event which involves force and injury, both physical injury and psychological injury. So that can interfere with the future sexual, you know, experiences.
Or desire. All right. And in terms of, so that is more on the beliefs, and then there's also that aspect of experiences. Okay, so what about the hormonal
aspect?
Yes.
The hormonal aspect affects women, especially when they are close to menopause. And when they are
what
post
age is that?
menopause. That's the age. Generally, it's the age of around 45 years of age. But a lot of literature quotes from the age of 51 to the age of around 60. And that is because one of the hormones that whose level goes down significantly is called estrogen. So the two main hormones that are involved in the reproductive cycle of a woman are progesterone and estrogen. So estrogen is very important when it comes to sexual activity, because it protects the vaginal canal. So it keeps the walls, you know, supple and soft, and so it has to do with it. How do I put it? It improves issues to do with moisturization, and so it reduces friction. So when you get to menopause, this hormone goes down significantly, because your ovaries basically, like the production from the ovaries ceases in a way. Of course, it's a process. It doesn't just stop
instantly.
So it's a process. So when they are significantly low, then you'll have issues to do with the pain, discomfort, and even the desire itself.
It goes
because
away.
The ovaries, they also produce another hormone, another type of hormone called the androgens, and they are also very significant in terms of sexual drive in women. So when it goes down, then
yeah,
generally
I
yes,
think we'd
the
say
whole
all the
thing just
aspects,
yes,
and
yeah.
especially the first stages that we talked about. Okay, now
Yeah.
we need to go for a very short break. But
Okay.
I had something that women in their 40s, that is like their sexual peak. All right.
Yeah.
So yes, of course. So when we come back, of course, we want to
We'll
understand.
talk about
Wait.
it,
So
yes.
menopause and all that. What exactly happens?
Yeah.
And of course, we also talked about the aspect of other illnesses that might cause,
Yes, yes.
female sexual dysfunction. But yeah, so let's take that short break. But of course, when we come back, we still have so much to discuss. But if you have a question on the same, then feel free to call us live. 0791 478990 is the number to call in live. And of course, we'll answer your question as soon as we get it. You do not want to miss the other interesting part of the discussion. Stay with us. All right, welcome back. Glad you're still with us. Interesting discussion we were having over the break. But thank you so much for keeping us company. Now, like we're saying today, we are focusing on female sexual dysfunction. Of course, we're looking at some of the different causes and different types of female sexual dysfunction. But if you have any question, then feel free to call us live. 0791 478990 is the number to call in live. And of course, we'll answer your question as soon as we get it. Now, before we went for break, Dr. Grace, there's that aspect of a woman's sexual peak, and that is at 40.
Yes.
And then menopause kicks in.
Yeah.
Yeah.
Bummer.
Yeah. Now, what happens? Let's talk about the sexual peak first of all. Why is it? Why 40?
I think it's not really anything to do with the hormonal aspect, in my opinion. I think it has to do with the fact that the woman at this age of 40, call it the fourth floor?
Yeah.
I think it's the fourth floor.
Yes.
The fourth or fifth? Fourth floor.
Fourth floor. Yeah.
So the woman at this stage is a confident woman. Childbearing has almost like they have finished or rather they have achieved their desired family size. So she's not pregnant or looking to be pregnant. She's not breastfeeding. She's probably financially stable, probably. But I think it comes from confidence and also from the fact that she probably has been getting involved in sexual activity. As you said, it takes practice for some time. So they are confident in, it's like you have mastered the art. So they are enjoying it and they're not afraid of, you know, the stigma. They're not afraid of society, you know, and I think all those factors really play a major role in helping them to boost their sexual activity.
Okay.
Yeah.
All right. And then menopause kicks in.
And then menopause kicks in.
And it's like.
But even with menopause, there are remedies. They may not completely reverse the process, but they help. They help to alleviate some of the symptoms.
Okay. And
because, as we said, it involves a lot of mental issues, psychological issues. If a woman has, you know, as we said in the 40s, mastered the art of enjoying herself, then it would be much easier later on. Because actually it is said, or scientists say, that how to prevent the issues of sexual disorder later on in life is actually to regularly get involved in the sexual activity itself. Okay. So that it's like because as you're getting involved in the sexual activity, you are generating or producing, you know, the good feel hormone, and your body gets used to it. So it's the risk of you developing a sexual disorder later on in life is much lower than someone who's either rarely involved in sexual activity or has never been involved in sexual activity. Okay.
You know, when you say that, people will be like, hey, so now...
But I have to put a caveat. It has to be in a committed relationship or marriage.
Yes.
I am not in any way encouraging responsible sexual behavior. Yes.
Okay.
No.
All right. Now, in terms of, when you start, like the age that you start, let's say being sexually active, also play a role in either alleviating or either promote sexual dysfunction? Because you said the number of times or how frequent you involve, of course, lowers the risk of sexual dysfunction later on
in life.
But there's some people who start early, like 10, 9.
We do not encourage such a you know, low age, if I may call it, sexual abuse, because it comes with other risks.
Okay.
One, this person who's getting involved in sexual activity at such a young age, they're basically children.
Yeah.
For lack of a better way of putting it, they are just basically children. So who need to be protected from such sexual activities, either with someone they know, because they are not at an age where they're able to consent, you know, from an informed point of view to any form of sexual activity. The other risk that comes with having very early sexual debut are issues to do with sexually transmitted infections, the risk of acquiring HIV, the risk of acquiring HPV, which later on can give you cervical cancer. So we really don't encourage young children. We are completely against it because we deal with the sequelae later on of such incidences. And it is happening. We are seeing it.
Okay. All right. Now let's talk about some of the illnesses that can also cause female sexual dysfunction.
So some of the medical conditions that can cause sexual dysfunction, one of the biggest is actually psychiatric illnesses like mental health challenges like depression. So depression, because depression interferes with a person's outlook of life, they are low. So they are low in every aspect. They are low in the way they look at themselves, in the way they look at other people, in the way they feel they should enjoy whatever it is. So they will not enjoy sexual activity with their partner if they are depressed. Also, some of the medications that are used to treat depression, one of the side effects is low sexual drive. The other medical conditions that can interfere with the sexual drive include diabetes, because one of the other aspects involved in the sexual enjoyment and the sexual cycle has to do with things to do with nerves and some hormones in the brain. We call them neurotransmitters. So in some of these illnesses like hypertension, diabetes, it interferes with production of these neurotransmitters and also the function of the nerves. So because for you remember that stage we talked about the orgasm, the contraction of muscles. So for the contraction of muscles to happen, you have to have involvement of a nerve, a certain nerve. So if you have long-standing diabetes or hypertension, you might have a dysfunction in that nerve that interferes with you enjoying your sexual activity. The other medical condition, a common one, is the thyroid disorders, especially if your thyroid levels are low. So if the thyroid hormone is very important in the body, it's involved in a lot of functions in the body. So if your thyroid hormone is low, it is likely to interfere with your sexual drive. And even you enjoying the sexual activity itself.
Okay. All right. And hysterectomy.
Yes.
So first of all, what is it and how does it affect, the female?
The female. Now, the hysterectomy is a surgical procedure that is usually is employed when you are treating conditions like fibroids or early stage cervical cancer or endometrial cancer or mainly those ones. Those are the commonest indications, unless in emergency cases, like if a mother is bleeding too much after CS, then you're forced to remove the uterus because it's a uterus that's bleeding. So it's a surgical procedure, it's a major surgery that involves removal of the uterus itself. So if the indication was because of, let's say, we call them symptomatic uterine fibroids, either fibroids that are causing pain or bleeding, then it involves also removal of the cervix itself. Yes. So the cervix is usually removed because you want to eliminate, in a way, the risk of this person getting cervical cancer later on in life. So the minute you remove the cervix, because the cervix, the uterus, and the tubes are connected. So the tubes are separate, but the cervix and the uterus, it's like they are one thing. They're just in different places in a way. So hysterectomy involves now removal of the uterus plus the cervix. But in an emergency case, you don't remove the cervix.
The cervix, yeah. Okay.
Yeah.
So of course that's lowers, like, let's say, sexual drive.
No, I would say it lowers because if you have not removed the ovaries,
Yeah.
because the ovaries are the ones that are involved in production of the hormones that give you sexual drive. So if you have not removed the ovaries, you are likely to still have the sexual drive and desire.
Okay. All right.
So what it might interfere with is probably the experience itself.
Oh.
Yeah.
Okay.
During the sexual activity. Because it is known that the cervix has a role to play during sexual activity, especially when it comes to attainment of the orgasm. But the caveat is, if you are a person who has undergone hysterectomy, it is not doom and gloom for you, because one of the very sensitive organs when it comes to sexual activity and sexual arousal and sexual enjoyment is actually outside of the vagina. It is the small part called the clitoris outside. So if you have undergone a hysterectomy for any one of those indications we've talked about, then you can have your partner direct the activity to the other part for you to enjoy it.
Okay.
Yeah.
All right. It's not all,
It's
like you
not
said,
doom and
gloom.
No.
Okay.
Yeah.
All right. Now, diagnosing. I know we talked about it earlier on, and we said it's challenging.
It's challenging.
Yes, to diagnose, let's say, a woman who has sexual dysfunction.
Yeah.
But it happens anyway.
Yes.
There's a way. So someone comes to you, probably talks to you about maybe the lack of either interest or the lack of orgasm. So what happens? So it's the first step to diagnosing this.
So if
but before you answer that, you have a caller on the line, Otieno from Huruma. Atieno rather, not Otieno. All right, good morning. Oh, okay. We seem to have lost Atieno. All right. So Atieno, if you're watching us, please call us back. Of course, we'll answer your question. Now, diagnosis.
Now, when diagnosis involves not really stages, like there are several, it's like a process of sorts.
Okay.
So it will involve talking to the patient, what we call history taking. So it will involve, the patient describing how do they feel, do they feel anything in the first place, do they enjoy sexual activity in any way, or any other factors around, sexual activity. Do they have any illnesses? Are they on any medication that probably could need adjustment or changing? Have they had any surgeries? Have they given birth before? Have they had a traumatic experience in the past, as we talked about sexual assault? And then after that, we will need to do a physical examination.
Okay.
Of course, it involves the whole body physical examination. You take their blood pressure to check if they have high blood pressure. And then you do what we call a pelvic examination to see if there are any, if, for example, they said they have pain, you might want to find out, do they have any growths in the pelvis? Do they have any signs of an infection? Do they have any restrictions of sorts in their reproductive system that could interfere with sexual activity? So the highest percentage of diagnosing comes from just those two.
Okay.
Yeah.
All right. We have a caller on the line, Agnes from Nyeri. Good morning, Agnes.
Good morning.
Thank you so much for calling us. Do you have a question for Dr. Grace?
Yes, nataka kuuliza. Like 3 months ago, I was diagnosed with origo. Good morning, Agnes. Good morning.
Agnes, if you can hear me, kindly just turn down the volume of your TV so that we can communicate.
Okay.
Yes.
Like 3 months ago, I was diagnosed with follicle ovarian cyst.
Okay.
Last week, I understand about it, but I was booked for a clinic on February. So I don't know what is causes and the symptoms. But I have been having spotting all through these 3 months.
Okay, so follicle ovarian cyst for 3 months. Okay, so I didn't quite get your question. Or did you get her question?
I did not.
We did not get your question clearly, the last part. So your question was?
the doctor to explain me about the ovarian cyst. I don't know what it is.
Oh, okay.
I was just diagnosed and booked for a clinic.
Oh, okay. Sawa, sawa. Thank you
Yes,
so much, Agnes, for calling us.
thank you.
All right. So, yeah, she was diagnosed with follicle ovarian cyst. Doesn't know what it is. And then, yeah, then probably you can tell us if it can have a role in the topic that we're talking. Yeah.
I'm not sure the diagnosis was a follicle ovarian disease, because the common one that we know is called polycystic ovarian disease.
Okay.
So what she's saying, follicle ovarian, a follicle is it's a like a pocket. It's usually inside the ovary. It's like a pocket that usually has the ovum inside it. So it's a normal thing in the ovary.
Okay.
So the ovary tends to produce these cysts, and then they grow with time, and then during ovulation it releases one of them. But for some women will have what we call polycystic ovarian disease or polycystic ovarian syndrome,
Okay.
where you have many of these pockets with fluid inside, which is not a normal thing. Like the number is above what is normally or physiologically accepted.
Okay.
Now, this the polycystic ovarian disease doesn't necessarily interfere with the sexual function unless the size of the ovaries is large enough to start causing pain during the sexual activity.
Okay.
Yeah.
All right.
What it interferes with is things to do with the menstrual cycle. It can interfere with the menstrual cycle or the ability to conceive or to carry a pregnancy.
Okay. All right.
Yeah.
Okay. Now back to I think we were done with the diagnosis part.
yes.
Now treatment options.
Treatment options.
Yes, for the women, because like we said, the blue pill does it
For the
apply?
men. Oh, yeah.
For the women. Yeah.
So the treatment options depend on the cause.
Okay.
So after you have talked to the patient, you have examined. Laboratory investigations are rarely done, because probably the only laboratory investigations you would need to do is to check whether they have a thyroid problem. Hormonal levels have not been shown to help a lot with the trying to get the root cause of the problem.
Okay.
Scans or X-rays rarely help unless you're trying to diagnose a growth or an infective process. So treatment options depend on what the health expert or the health professional feels is the cause of the problem. So it can be a medical treatment or non-medical treatment.
Okay.
So for example, if it is something to do with past experiences like sexual assault, then that probably would involve a lot of counseling and helping the patient or the lady overcome that experience and bringing her to a point where they are able to enjoy the sexual activity with, a safe partner. If it is a growth that is causing maybe pain or discomfort, there are different modalities of treatment. It could be it could involve surgery or just medical treatment. There are also, in terms of discomfort, like for example, if there are issues of dryness or pain, you could prescribe gels. There are some gels that contain estrogen that help with the softening of the vaginal wall to reduce the discomfort. But one of the main modalities that is employed is actually counseling, psychological counseling, because as you said, the brain is said to be the largest sexual organ, so you need to help this person overcome their fear or their concerns. The other one could be like if the patient is on treatment for any of the medical conditions that we mentioned, it could involve adjusting the doses or changing them altogether.
All right.
Yeah.
Okay. And then does it also depend on, in terms of like the course, does it determine when or how long you will be on treatment?
On
either
treatment, yes. Yes.
medically or non-medical?
So if it is something to do with the change, let's say for example, if you're on antidepressants or antihypertensives or diabetes medication, it's a balance between, you know, treating the medical condition you have and adjusting the dose of the drugs that are giving you this bad side effect, such that you don't topple one over the other one. So it involves a bit of a balance. Yeah.
Okay. All right. Now we have a question. This is from Lydia.
Yes.
And she says she cannot go a day without, let's say, intercourse. So she's asking, is this a problem or is it normal? And also remember we said if you do this often, it lowers the risk of sexual dysfunction later on. So is this a problem for Lydia? Or it's okay?
Okay.
Yeah.
So for normal sexual activity, normally it's usually said like within a span of 7 days, maybe, you know, 3, 4, 5 times is, you know, the average.
Yeah.
The average normal.
Okay.
But there is also some, I don't know whether it has been included in the psychiatric diagnosis manual, what we call the DSM. I think there used to be, this is a forte of psychiatrists now, there used to be a condition called hypersexual syndrome or something of that sort, where it's like you have sexual addiction of sorts. So I would say it's a problem if she cannot control her urges. If her urges interfere with her social interaction, with her professional interactions, if she works, with her daily activity, like she feels if I don't do this, then it's like I am, you know, I am in a very bad place. But if it is just for enjoyment and, you know, the partner has no problem with it, then go ahead and enjoy yourself.
Yeah. Okay. And does the number of times, because I'm thinking for Lydia, she says she can't go a day. So suppose she's like maybe a day, but like once a day, or
once a day is fine.
That is fine.
That's why I'm saying it would become a problem if she cannot control her urges. Like if, you know, she sees a person of the opposite sex and she just wants to jump into the activity, then that's a problem that would need intervention. But if it is something she controls and, you know, she feels that she enjoys it every day, then that's okay.
And it doesn't affect her.
It does not affect her day-to-day activity, daily living.
Okay. All right. So Lydia, there you go. If it's once a day, then you're good to go. No worries.
Yeah,
okay.
no worries.
All right. Now, so how do we, is there like a prevention, ways that maybe we can prevent female sexual dysfunction?
Oh, well, ways of preventing it is probably what I talked about. Like once you get into a committed relationship or once you get to an age where you're able to consent to sexual activity as an adult, then it's good to, you know, get involved regularly in, of course, within, as I said, confines of safety and decency. It's good to be, you know, regularly involved in sexual activity because it actually also boosts your general health. Because as we said, during the activity you produce the feel-good hormones, so they make you feel good and, you know, your body relaxes. So it improves your general health. So it's a good thing to be involved in. So you know, get involved in it as much as you can. The other thing is to practice safe sexual activities, use of condoms, like if you're not married, or so that it protects you from, you know, STDs. If you're in a committed relationship, you know, faithfulness to one partner also helps. And also just protecting generally your mental health. If you have any mental issues, seek help. It will protect you later on in life.
All right. Now, and how does this affect women, let's say in general? Suppose someone has, you know, this condition, how does she get affected in general? And then the second question is, so how can women manage the condition? Okay.
So in terms of how women are affected, I wouldn't say it would cause you like, you know, a pain. No, I don't know how to put it. Like it wouldn't. It's not an illness that will, you know, lead you to your death or something. But of course, it robs you of of that, you know, pleasure and just general well-being. So it interferes with your health generally. And it probably, you know, interferes with your social, intimate social interaction with an opposite, with your sexual partner, such that you're not, your relationships are not, you know, optimal, if I may put it that way. Because let's say you're married and you're having this difficulty with the sexual function, then your partner is likely to have a problem with it, and it's likely to bring a strain in your relationship. So it's likely to interfere with your mental health also, because especially if you haven't sought help, you're likely to start wondering, you know, what's wrong with me. You might become averse to, you know, seeking intimate relationships. So yeah, it interferes with women's health generally. Yeah.
All right. So how do they manage?
To cope?
Yes.
It's basically just knowing yourself. It's also good as a woman to know yourself. It's good to know your anatomy.
Yeah.
It's good to know your anatomy. If you are not able to know your anatomy, visit a health professional, you know, a licensed practitioner, you know, and tell them I'm having this problem and I'd like to know, you know, how do I go about it. Yeah. Also educate yourself. We are in the digital era, and but also try and as much as you're educating yourself, educate yourself in the confines of, you know, safe information. Safe information. Eat well, sleep well, exercise. Exercise is very important in terms of boosting sexual activity. If you've reached the age of menopause, there are not home remedies, there are supplements that help to alleviate some of these symptoms. There are, you know, hormonal replacement therapies. There are also creams, as I mentioned, estrogen-based creams. And even if you've not gotten to menopause and probably you're having difficulty during the activity itself, probably, you know, discomfort or dryness, there are lubricants that can be used. So it is good to educate yourself. The other issue is to overcome the fear of talking to a health professional about it, because a lot of women either will beat around the bush about it or will not at all talk about it. So it's good to be open about it. It's a common thing, and it can be, you know, managed in a way.
And what about to those partners who, let's say the other partner is having this, the condition. So how can they also help this person? Because like we said, it can be frustrating and very difficult for both parties.
For both of them,
So how can they help their partners to cope with the same and also take care of themselves? Because like we said, they also get affected when their partner is affected.
So as I said, it's just generally taking care of your health. Exercise, you know, eat well, sleep well. Ensure that generally your body is at an optimum level. Manage your stress. Stress, especially for men, has been shown to affect their sexual drive and performance. The other thing to control is alcohol. Alcohol use, especially for the men. Because sometimes, especially men who maybe are anxious about sexual function, they think that when you drink, then you'll become confident to be able to perform sexually, but it does the opposite actually. So it dims that you know, activity. So the other thing is communication. Communication. Talk and understand each other.
And of course, that is supporting your partner and not letting them know that.
Because if you make them feel bad about it, it just makes the situation worse. So, and if you cannot come to a consensus or a place where you are able to solve the problem yourself, then it is good to seek professional counseling services.
All right. Now, you talked about it's important to maybe engage or involve yourself in the activity as frequent as possible. But there are, let's say, religion or other beliefs or cultural, culture, you know, cultural beliefs, that tend to, you know, be, I don't know if it's to dim or caution or, you know, yeah, all those things.
I
So,
think
so
the
what
word
happens?
should be
Yeah.
demonized. Like
Oh, yes, exactly.
They demonize the whole issue of sexuality and you know, issues to do with sexual sexual activity and performance.
Yeah.
And I think especially from a religious point of view, I am a Christian, but I feel that the religious community needs to come up with a way of addressing this issue without demonizing it.
Okay.
You know, demonizing it, especially
Okay.
for the young girls. And also those who are, you know, in the reproductive age group, or those who are almost getting married, because in the church you talk about, you know, sexual activity
Purity,
is limited
yes,
to marriage, which is a good thing. It's protective. But you need to address it in a way that you help both parties, you know, both the man and the woman to enjoy the sexual activity when they consensually agree.
Yes.
To have it.
Okay.
Yes.
All right. So we need to end the show right now. Sadly, time really, really flies.
That's
Yeah. But now we have a better understanding on what
Yeah.
sexual dysfunction is all about. And
Yes.
like we said, this is a topic that we don't talk about it like every so often.
Yeah.
So it's important that at least we address, you know, this thing. So thank you very much for coming over today.
Welcome.
And of course, thank you so much for staying with us till the end of the show. I believe that now you have learned a thing or two on female sexual dysfunction. But from what we said is exercise is very important for you as a lady. And let's not demonize, you know, this whole thing, because at the end of the day, it's important. And of course, some of also the ways that we can prevent female sexual dysfunction later on in life. So my name is Winnie Lubembe, and on behalf of the entire team who made the show success, we wish you a lovely day ahead. We'll see you again next week on Monday, same time, same place. Have yourselves a lovely day ahead.